Hello, my name is Lashaya Gray. I'm an occupational therapy student, and I will be presenting and talking about fetal distress and abnormal forces on labor. For those of you that are wondering what it is or what does it look like, well, fetal distress occurs when there are indicators or signs that the fetus, which is the baby, is not coping well with the stress of labor. This can present or show changes in the fetal heart rate, which means it could be dropping or increasing. There could be the presence of fetal stool in the amniotic fluid, or abnormal fetal movements or responses caused by numerous factors, including inadequate oxygen supply to the fetus, umbilical cord compression, maternal health issues during pregnancy, and or other underlying conditions. As a result, this can cause complications to the fetus or unborn baby, resulting in brain damage, death, and even, in some cases, stillbirth. Whereas abnormal force of labor refers to the name itself, meaning that the labor is not normal for an expecting mother. This may include prolonged labor, abnormal contractions. The baby may be in a breech position, meaning it could be coming feet first instead of head first. The mother may start to bleed excessively, and this creates complications for both the mother and the fetus as well. When it comes to the history, studies show that African American women are more likely to experience abnormal forces of labor and fetal distress compared to any other race. They are also more likely to have C-sections. The understanding of fetal distress and abnormal force of labor has evolved over centuries with improved and advanced technology, which was not available years ago. There are also now tests done where a sample of the amniotic fluid is collected for testing to ensure that the baby is properly developing. There's also surgery done in some states where the baby is actually removed from the mother's womb in the presence of abnormality or lesion, and the surgery is performed and the baby is put back in the mother's womb to continue development. However, even with advanced technology, abnormal force of labor and fetal distress still occur. And one of these cases happened with, Serena Williams, where she experienced preeclampsia and she was in pain during labor, more pain than expected. Even after she had her baby, she was bleeding excessively, and her pain got worse. And so her physicians did ignore her, and she almost died, her and her baby, as a result. And in this cases, this happens to a lot of African American women. When it comes to incidents, about 700 women die each year in the United States as a result of pregnancy or delivery complications. Although Caucasian women experience similar circumstances, fetal distress and abnormal forces on labor occurs less in their population. As it relates to prevalence, 2,139 African American mothers in the United States were surveyed in a study, and 17% reported that they experienced loss of autonomy, being ignored or not being heard during labor, and doctors ignoring their level of pain. And this is from source Sarawatwi, 2019. C-sections are also more common in this population, where African American women are 24% more likely to undergo C-sections than African American women as a result of fetal distress. As it relates to morbidity and mortality, as I stated previously, fetal distress and abnormal forces of labor can lead to various complications for both the mother and the baby, including a loss of oxygen levels are low, birth injuries like dislocation or head injuries, maternal exhaustion, which occurs when the mother becomes exhausted and just doesn't feel like pushing anymore. There's also the concern that the baby can be stillborn as a result of distress, and the mother can also die as a result of abnormal forces on labor. It is important to remember that the mother and baby are connected. So what the mother is feeling or what the baby is feeling has an effect on the other. If the mother is in distress, then the baby will start to become distressed or experience problems, which can cause possible death for the mother as a result of complications and the baby as well. When it comes to the etiology or the cause, uterine uterine placental efficiency can occur. That's when there's inadequate blood flow or oxygen transfer from the baby to the mother. From the mother to the fetus through the placenta. There's maternal health conditions where the mom could have diabetes, preeclampsia, or chronic hypertension where her blood pressure is too high, and that can cause stress for the mother and the baby. There's also chromosomal abnormalities in the fetus. So if the baby has Down syndrome and other abnormalities, that can cause a stress on the mom and increase abnormal force of labor. There's also where there's maternal hypoxia, what can impair oxygen delivery to the fetus. There can be the use of drugs where that can cause an impact for the baby, especially. And there's also fetal alcohol syndrome where that can cause distress also. And then there's also the concern of cancer and women who have sickle cell anemia that may get pregnant. Their condition can also cause a distress to themselves and the baby during labor as well as umbilical cord compression. When it comes to the abnormal forces of labor, when it comes to the cause for the mom, it can also be maternal obesity, stress during pregnancy. Sometimes doctors can have an effect on the mom, which can cause stress, and then also inadequate health care. So that's why it's important to take care of your body when you are pregnant. There's also cephalopelvic disproportion, where this occurs when the size or shape of the maternal pelvis is not compatible with the size of the fetus. So it can cause delivery sometimes difficult or impossible. When it comes to the pathogenesis and pathological perspective, fetal distress and abnormal force of labor involves various factors that can cause the fetus overall well-being to be compromised. This can include, like I stated earlier, hypertension, placenta abnormalities, placenta efficiency, and it involves inadequate blood flow to the fetus. There's also prolonged labor, which releases stress hormones from the fetus and leading to changes in the the fetus heart rate patterns and other signs of compromised well-being. When it comes to clinical manifestations, fetal distress may manifest clinically as present, so tachycardia or bradycardia, where the heart rate is either too high or too low, or indications of compromised oxygenation, failure to progress, or abnormal fetal presentation. Then when it comes to the complications and sequelae, as it relates to labor and complications, during labor, birth injuries such as shoulder dislocation, fracture to the clavicle bone, injuries to the skull, like I stated earlier, maternal exhaustion can occur, and that involves the increased risk of operative deliveries. And complications after labor can follow birth trauma for the mother, and in some cases can cause long-term neurological effects in the baby, which can cause cognitive impairment, cerebral palsy, stillbirth, or death in some cases. There's also the concern for developmental disabilities or developmental delays, where occupational therapy services or interventions would take place. When it comes to precautions or contraindications, when fetal distress is suspected or diagnosed early, a healthcare provider may recommend close monitoring of the fetus, so that may consist of more follow-up appointments or monitoring vital signs and heart rate. And when it comes to that, encouraging the mother to avoid excessive exertion may help reduce pressure to the uterine, and the mother may be encouraged to change positions during labor. As it relates to the risk factors of fetal distress and abnormal force of labor, risk factors can include hypertension, so that could be high blood pressure, stress, inadequate healthcare during pregnancy, smoking, usage of alcohol, which you're not supposed to use at all during pregnancy, obesity, environmental toxins, so that can be the fetus being exposed to lead or chemicals early that they shouldn't be exposed to. Secondhand smoke, and poor dieting as well. For those of you that do not know, development of the brain is crucial in the first trimester especially, and proper development of the neurotube, which can cause developmental delays or disabilities if there's not proper care during pregnancy. When it comes to prevention, as expecting mothers, mothers cannot always control what will happen during labor. However, during pregnancy, it is important to take proper care of your body for both you and your baby so that the likelihood of complications and fetal distress can be minimized. So that can require careful monitoring of the fetus during pregnancy, stress management, taking prenatal pills regularly or as needed, well, not needed, as your doctor prescribed, voicing any concerns about the fetus, and follow up with scheduled appointments. Most importantly, you should take care of your body. That is very essential. Have a balanced diet. Avoid drinking and smoking, as stated, and eating healthy and staying away from foods that may not be healthy for you and your baby. And sometimes that can also include spicy foods. As it relates to clinical management of fetal distress and abnormal force of labor, that can involve a combination of interventions, decision making to increase the likelihood of positive maternal and fetal outcomes, as well as a combination of monitoring. This may include labor progress assessments, maternal positioning, so the mother being moved as stated, and oxygen therapy. So that's where oxygen is administered to the mother if the fetal distress is suspected. Occupational therapy intervention or services may take place as a result of fetal distress or abnormal forces of labor. This happens when there is distress to the fetus, and sometimes there is damage to the brain, which causes cognitive impairments as well as challenges stemming from birth complications as a whole. Fetal distress can also be the result of chromosomal abnormalities, which can cause developmental disabilities and delays. An occupational therapist can provide specialized care to infants and help them reach their milestones through various ways. They will assess the baby's developmental milestones and create an individualized intervention to address deficits and fine motor skills, gross motor skills, sensory processing, and or feeding and swallowing abilities. A few examples may include teaching the mother positioning and holding techniques, educating the parents on better breastfeeding techniques, exercise to help strengthen swallowing or sucking for feeding difficulties, as well as introducing the baby to various textures of foods. Other types of activities may include tummy time play as the baby gets older to promote the development of head control, rolling over, and crawling, as well as grasping activities for fine motor skills. Current research shows that fetal distress and abnormal forces on labor is still a current problem, and researchers are currently focusing on improving monitoring techniques on fetuses, understanding other underlying causes of abnormal forces on labor, developing better training for healthcare providers, as well as developing more groups for expecting mothers that focuses on the importance of adequate health care during pregnancy in order to promote better birth outcomes for both the mother and the fetus and reducing complications as a result. Thank you, and I have included my references also.